This is Tomah Health Marketing Director Eric Price. On this edition of HealthCheck 360, we'll take a look at our rehabilitation services, which includes physical therapy, occupational therapy, and speech therapy. Our highly regarded physical therapy team at Tomah Health develops exercise routines that are effective and individualized. Our team tailors to individual needs and goals, working side by side with each patient to include activities designed to increase strength, flexibility, range of motion, and balance. Let's meet physical therapist Emily Wall.
Some of the rehab services we provide at Tomah Health, we have a pretty broad range of physical therapy, occupational therapy, and speech pathology that we provide here. We see a lot of different orthopedic conditions, from post-surgical patients to back pain and neck pain. We see different neurological conditions, traumatic brain injury, stroke. We see people with Parkinson's, multiple sclerosis. We treat vestibular patients for dizziness and vertigo. We treat pediatrics from the autism spectrum to developmental delay. Our speech pathologists see different swallowing patients. We provide top-notch care at Tomah Health in the physical therapy department by having different clinicians trained in different specialty areas to provide great quality care to all of our patients that is close to home. FOTO is an acronym that stands for Focus on Therapeutic Outcomes, and it's a measurement tool that our staff uses to find out what a patient's impairments are from their perspective. And throughout the course of care, we ask the patients these questions again to see what type of improvement they're getting towards their functional outcome. We use the FOTO scores to help us see where we may not be as good and try to educate our staff to do better in those areas to allow us to improve our FOTO scores to give the best quality care to patients in our area. Our aquatic pool is wonderful. It has an underwater treadmill. It has different heights so that patients can stand and be buoyant. It allows them to unload their joints. We can work on things like balance and proprioception and strengthening when they're in the pool. And there's really some outcomes that I've never seen on land before that can be achieved in the pool. So it is a complete asset to have that so close to home in Tomah. We have a very close relationship with the surgical department here at Tomah Health. We see patients both preoperatively and postoperatively for their care to give them expectations of what to expect for surgery to be able to go home and have success, along with providing them care postoperatively.
Our occupational therapy promotes health and independence in everyday life. Our experienced occupational therapists work with patients to customize treatment programs that restore and enhance their ability to develop, recover, or maintain the daily skills needed for a healthy life. Let's meet occupational therapist Alex Morgan.
Tomah Health offers a wide array of occupational therapy, things including outpatient orthopedics, pediatrics, occupational health, neuro rehab, and our inpatient services. So, easy way to sum up when someone needs occupational therapy is whenever a diagnosis or an injury really interrupts their ability to do their everyday tasks, whether it be a wrist fracture results in someone not being able to do their work, or our stroke survivors who have challenges with dressing and other self-cares. So the root of kind of occupational therapy is everyday things. Your ability to tie shoes all the way up to work tasks. Those are considered your occupations. The ability to see someone local is a massive change because it's a situation where maybe if they're driving 45 to an hour, they're only able to get to a visit one time a week or every other week, and it's putting a lot of pressure on them to take their care in their own hands in that situation. And being local, they're able to have someone to support them through that, whether they do like them handling it on their own or need the extra support. We have that option to provide for them. What I like most about providing occupational therapy is seeing the patients return to the activities they care about.
Whether it's dealing with a patient with after effects of a stroke or a young child needing assistance in reaching language milestones, our speech-language pathologists at Tomah Health identify activities to strengthen areas of weakness and work one-on-one to help each patient achieve their communication goals. Let's meet our certified speech therapist, Madeline Kennedy.
So at Tomah Health, being in a rural hospital, we really have to do it all. So we are generalists, but our most common diagnoses are probably autism, language disorders, speech disorders, and Parkinson's disease. We also have a high prevalence of head and neck cancer, as we see patients for their swallowing or their voice during their cancer treatment. As a speech pathologist at Tomah Health, my favorite things probably are our adult patients that I get to see as we work on their functional rehab of returning to home after a stroke or a brain injury or after cancer, and then our kiddos, just being able to work on making them able to communicate and enjoy things as they continue to grow. At Tomah Health, a speech-language pathologist works with occupational therapy and physical therapy in our outpatient setting. So for pediatrics, working with sensory disorders or kiddos with autism, we do sometimes some co-evaluations, meaning we're both in the room helping the child, coaching the parent from a communication standpoint as well as activities of daily living. From an inpatient standpoint, we're working with the nursing staff to make sure the patient's swallowing safely during meals when we aren't there. Registered dietitians and I work together to make sure a patient continues to get the nutrition they need during their cancer treatment. So our team approach is very, very broad across all different disciplines. At Tomah Health, we really prioritize having care close to home, and something that speech-language pathologists do here are video swallow studies, which means watching you swallow on x-ray. You can have that done here so we can know if your swallow is safe. Other things is during your head and neck cancer treatment, you can have that treatment here during your radiation and chemo to have consistent care throughout time. A patient might come to speech therapy because either a family member or their primary provider notices that something isn't developing as it should with pediatrics. With adults, usually it's after an injury or a new diagnosis. So a stroke, traumatic brain injury, a new diagnosis of cancer. With aging, as their swallowing becomes more difficult. So a primary care provider will then refer you to Tomah Health. You'll come in and you'll meet your therapist, and then we'll make a plan together. What are the areas that are difficult at home? What are the areas that are keeping you from doing what you love? And then we work as a team to make goals that help you get back to what you were doing.
Thank you for viewing this edition of HealthCheck 360. At Tomah Health, we're inspiring health, wellness, and balance for our community. To learn more about Tomah Health and our services, visit us online at tomahhealth.org.